I'm Lexi. I'm a part of the Auggie community and happy to be moderating the event tonight, which is all about infant feeding with Sarah. Few minor housekeeping things, which is just to remind everyone that the event, the Zoom is being recorded, to be mindful of that. And if you have any questions come up, please just drop them in the chat, and we can ask Sarah throughout the presentation. So without further ado, I'll turn it over to you, Sarah.
Yes, I'm like trying to get my sharing screen back up. I don't know why it's not working.
It
Give me
just went
one second.
away. No problem.
I'm like, technology is not my best friend, as it probably is the case for lots of people. But while I'm figuring this out, I'll say hi, I'm Sarah. I'm a registered nurse. I was a NICU nurse for just over 3 years, and a lactation consultant. And I did both for a long time. And then I went out on my own. And now I just do lactation consulting and newborn care. So I have my RN and my master's and the International Board Certified Lactation Consulting title, all those silly little letters. And today I'm just gonna attempt to just do like a overview of infant feeding, but it'll mostly just be questions because this is only about 7 slides. Um, so I guess I'll get started unless there's anything before we begin.
I think we should be all set to get started.
Okay, great. So I think of myself very much as a feeding consultant and not a lactation consultant because I don't subscribe to breast is best. And this presentation will kind of explain why that's my approach. So I'll just go over kind of the 3 higher level things. One is kind of the nitty-gritty physical skill of breastfeeding because that does require like specific physical things. And then 2 is an overview of like, what about infant feeding can we not control? Because I feel like that's not spoken about in a lot of like infant feeding prep classes. And I think it's really important because it takes away a lot of the self-blame that I think some parents feel. And then the third is just kind of the hill I'll die on, which is the social pressure versus the reality of infant feeding. Okay, so the physical skill of it. Latching your baby is natural because you have breasts and your baby has a mouth, but it is not intuitive. It's not part of our culture anymore. So it is much like yoga or a really complicated dance where you're not just going to naturally feel your way into it, despite the baby's ability and like the fun fact that they can crawl up your body and breastfeed on demand. It doesn't always go that way. It is like it's a thing you kind of have to learn together with your baby. Um, so we're going to leave the presentation just for a second and go to a video, which I think shows deep latch in the best way I've seen. Um, and I'll kind of narrate through it. You may have seen this video if you're been sleuthing around the internet for a deep latch video. So a baby at a pacifier or a bottle latches like this, just comes straight to a mom's kind of nipple. We want to avoid this when we're latching a newborn because it could potentially cause us pain, but more importantly, um, baby's not going to get much milk. And the transfer of milk is what drives supply. So boom, when you end up on that areola, there's that flow. So how do we get a baby's tiny mouth onto the areola of the breast? This is where the not intuitive part begins. We bring the baby into breast nipple to nose, almost as if they're going to latch below the nipple. We bring them into the breast chin first, and we barely clear over the nipple. Then they're on that areola, they're transferring effectively, and they're not causing you pain, hopefully. And bonus, their nose is off the breast. So they've got a good, clean airway going. So this is how you're likely going to get the best latch after delivery. That being said, if baby's swallowing and you're not having any pain, doesn't matter what it looks like. This is only for troubleshooting. So we want to avoid this. We want to avoid pursed lips just on a nipple. So that's physical skill number 1, deep latch. We just want to make sure we bring that baby into breast with a big old wide mouth and get them on the areolar tissue and not just that nipple. The second physical skill that I'll go over is hand expression, which is kind of self-milking your own breast. So I don't know if anyone in here has milked a cow, not implying that any woman is like a cow, but hand expression is very similar to milking a cow. And it's not intuitive. Like I remember I went on a field trip as a child to a farm and everyone was like trying to milk the cow and it's not intuitive. You kind of have to learn how to do it. The way you milk your own breast is exhibited here. Let me mute the video so you don't hear her too. You're going to hold your breast tissue in your hand, press straight back and squeeze in. So hold your breast tissue in your hand, squeeze back towards your ribs, and then press towards the nipple. Generally, women's instinct is to pull forward, like pull the milk from the back of the breast to the front, but we're actually pushing back. So why is hand expression important? It's important as long as you get the go-ahead from your OBGYN and you don't have like a high-risk pregnancy or any reason that you would want to avoid hand expression before delivery, you can engage in it once a day in the shower, starting at 38 weeks before you deliver, in order to practice the physical skill. And then once you deliver, if you engage in hand expression before latching your baby with that deep latch, you have a better chance of producing a greater supply faster. So because we only have an hour together, I wanted to go over these two physical skills that are not intuitive so that you can keep them in the back of your mind as something to practice at 38 weeks and then maybe replay that video from Global Health Media Project before you deliver just to remind yourself of that choreography. But I always recommend that if your goal, any part of your goal is to breastfeed, that you meet with a lactation consultant as kind of your choreographer, because that's essentially what I do all day is choreograph breastfeeding with moms. That hands-on care is really essential. Okay. So back to business here. We went over deep latch and hand expression. The frequency of breastfeeding is important because in order to establish a full breast milk supply, you have to tell your body that what the baby needs by removing it. So what you remove is what you make. So within 2 hours of delivery, you want to offer the baby the breast 10 to 15 minutes on each side, and you want to continue to do that every 2 to 3 hours around the clock. And if baby isn't gaining appropriately, that's when we start pumping, because it means that whatever the baby's establishing in your body isn't enough, and we've got to establish the supply with messaging from the pump. So the more you remove, the more you make. Those are kind of the three big principles of breastfeeding: early and often, hand express before feeding, and nail that deep latch. And if you have any issues in any part of this kind of overall theme of breastfeeding, I would reach out to a lactation consultant for help. Okay, the stuff you can't control. So you can't control your body. There are risk factors to having a lower supply. Age is one of them, thyroid disorder, gestational diabetes, previous breast surgery, birth complications, hemorrhage after delivery, preeclampsia, C-section. I mean, the list like goes on. There's so many extremely common things that are no fault of your own that can lead to a lower breast milk supply. So even if you do everything perfectly, you may not produce a full supply. So like I'm a nurse, I'm a lactation consultant. I've done this for 8 years. I only had my daughter 2.5 years ago, and I had a bunch of formula at home when she was born because I had no idea what my body would do. So it's just good to keep in mind that you could do everything perfectly right and get an A plus plus plus, and your body might just say like, hey, we don't have it. We don't have it all. And that's where formula is so great. It has everything your baby needs to grow and thrive. Breast milk has some like fun, really cool, interesting immune factors, and it establishes a microbiome. It's catered nutrition for your baby. It's very cool and healthy. Um, but any amount of breast milk is going to give your baby the benefit of it. It's not all or nothing. The other stuff you can't control is your baby. So sometimes babies are born disorganized. They can't latch, they can't do it. They've got small mouths. Maybe they have an oral restriction. Disposition. My daughter was just spicy. She's still spicy. And she came out and was like, I don't want to latch. And I was like, yeah, of course you don't, because I'm a lactation consultant. Um, and then your circumstances. So your birth story and your pregnancy, pre-existing conditions, all of this can affect the breastfeeding relationship in ways you can't control. So a lot of my job is just to relieve women of self-blame when it comes to breastfeeding, because it is definitely not a skill where if you do everything right, it'll go perfectly. It's a skill that it's good to know how to do it, express early and often, deep latch, hand expression. But even if you do all of that, we might not have enough. And that's okay. That's where formula is. I mean, we're so grateful for it. Okay, so the social pressure versus the reality of breastfeeding. So you may have heard psychologists talk about this in relation to social media, and I'll kind of get to that in a second. But when it comes to what I do, like we have far outpaced our evolution with the rise of technology, especially in Western educated, developed nations like America. We are siloed at home with our partners. We have minimal or no federal support, no covered medical support outside of the hospital, 6 weeks to 3 months of leave. And we're just kind of home with a support person partner, um, kind of blind leading the blind. So that kind of loneliness of the early postpartum period is way against what Homo sapiens are kind of meant for, which is small tribes, communal feeding, which can maybe answer a question if any of you have it of like, why wouldn't I produce enough? Like, aren't we supposed to survive? It's like, well, because if we were back in a tribe, your sister, auntie, friend, mom would feed your baby. Um, On-demand feeding would be natural in this kind of like tribal ideal. Our sleeping habits would be different because the demands of our day to day would also be different. So we'd probably rise with the sun and go to sleep when it goes down, and work in the fields all day and wear our babies. We're carrying mammals. So when you Google like, oh, the normal weaning age for a Homo sapien is age 4, and it's like, yeah, yes, it is. If we lived like orangutans, which we don't. So we have to kind of meet ourselves where we're at and know that we're pushing against our evolution with feeding this way, which is why I like put all these question marks here, why it makes me so confused why the World Health Organization and AAP would suggest 2 years. World Health Organization makes sense to me because they're making rules for the entire world and various levels of hygiene and circumstances. So for them, the safest alternative to dirty water and formula is breastfeeding, of course. The AAP suggesting 2 years in America, I just think is short-sighted of the circumstances in which we're feeding in. Okay, so that's that. Social frickin' media. This is just something I have a very love-hate relationship with. I'm on there physically almost like I have like slides for education purposes, but I don't add to it. I more use it for teaching. It is a wealth of information, but it's formatted into clickbait binaries of black and white, right versus wrong, this versus that, which takes all of the nuance out of how you feed your baby. And how you feed your baby is all nuance. We've got like, what is my baby doing? What is my body doing? What are my circumstances? What is my support system? There's so much. into what your feeding plan will be, that I would just urge all of you to attempt to stay away from any messaging that's telling you that there is a right or wrong way for you to feed your baby. Another thing to know about breastfeeding is because we have formula, there's not a ton of motivation to research breast milk. So much like we only have 1/3 of information about the world's oceans, we really only have like 1/3 information about breast milk and breastfeeding because there's just not a ton of funding, and it's ethically confusing to study breastfeeding moms, pregnant women. Women attempting to get pregnant. So that's why in the fertility space, in the pregnancy space, in the breastfeeding space, we're dealing with limited information. Um, so that's why you're getting kind of anecdotal and mixed information if you like ask ChatGPT about infant feeding, because it's aggregating all of this information that's kind of like pulled together by a bunch of little studies and not a ton of very easy black and white. This is what works, this is what doesn't. So it serves to not look into other people's buckets unless you're looking to fill them up. We're all different. The feeding journey is different. You kind of have to like meet your journey where it's at as much as you can. Um, so you can do this however you would like. That's kind of my main messaging with my lactation consulting practice. Um, that's my presentation. So I would love to hear from you guys, or I can go into more detail about stuff if you'd like me to.
Thank you so much. Yeah, anyone, please feel free to chime in with questions, unmute yourself, put them in the chat, however you want to do it. I'll just say I love how you're presenting everything and really emphasizing how nuanced it is, and not black and white. And I think that's such a good mindset to go into delivery with. There's so many
Totally.
factors that go into how your feeding journey is going to look.
Exactly, exactly. And much of it is out of your control.
Hmm.
So yeah, it's a smaller group. Does anyone want to ask a question? It's a quiet group. I can go through other things like pumping and bottling. I just figured that this would get us at least somewhere, but I'm happy to go into more things if there's, even if you
I'm
just want
curious too,
to.
yeah, people want to put in the chat when you're due or how old your baby is. That could be helpful too, just to get a gauge of the group here. Because now my daughter just turned 13 months old, so and I'm not breastfeeding until 2 or 4 years. So like
I don't know. I mean, the statistics are low on that for sure.
it'd be amazing. But yeah, it wasn't so easy for me. So I was happy to have formula and be able to use that. And she's very healthy and happy.
Yeah, exactly.
Maybe if you want to talk about how to choose a formula when you're going down that route, because I feel like I have a lot of friends ask, and I see in the community a lot, people kind of scrambling. How do I know which is the best one? Everyone suggests different things. So how would you think about that?
So with formula, it's good to remember that like the FDA is heavily regulating formula. It's very hard to be FDA approved um, in this country. It's much more regulated than the food that we consume. So all of them have very basic level requirements from the FDA in order to be approved. There is nuance between them, and it's a question of kind of where do you want to take risks. So I don't know if anyone in this group is familiar with Emily Oster, but her whole thing is like, what's zero risk and what's minimal risk. So the first 4 weeks of a baby's life, when their gut is sterile, they're born with a sterile gut. They get rid of that first meconium stool, and they've got this just like gut that's never seen anything. Um, when their gut is sterile, they're most susceptible to bacterial infiltration. And so most medical providers would recommend that you give a ready to feed formula because there's no risk of bacterial infiltration. Whereas a powdered formula, there's a slight risk. Is it a huge risk? No. but it's slight. So if you want to go like, I'm worried about a bacteria getting into my baby's gut, go with ready to feed. In that ready to feed world, which is mainly Enfamil and Similac, there's like a gentle formulary, there's an organic Similac. So if you care about organic or gentle, you would go one of those two ways. If a formula says gentle, it means that the curds are smaller. And what that means is it's less filling. So human breast milk, the curds are very tiny. They're like the size of sesame seeds. They run right through a baby. And it's why breast milk fed babies generally eat more frequently. Cow's milk, the curds are very large, kind of the size of a small almond. That's just like, we can't change that. But they have figured out in gentle formularies how to make it slightly smaller. So it's slightly easier to digest, the gentle formularies. And formula, just by design, because it's cow's milk, even if it's goat's milk, they're more filling. So once you get into kind of the powdered formularies, you get into, do you not want corn syrup solids? Do you not want palm oil? Now, a lot of the like issues with palm oil have been debunked, like the seed oil fears. They're not that bad, turns out, and we need fat in a formula for a baby to gain. And when I say corn syrup, that is a corn sugar solid. It is not the high fructose, genetically modified corn syrup that you get in like a Skittle. Um, so when you're choosing a powdered formula, you can kind of choose nuance in theirs, but I do like to clarify how there's like some messaging about seed oils and corn syrup. It's just a corn sugar solid in formulas. That was a very long answer, but there you go.
I don't know, that's very helpful. I didn't even know about the ready to feed, what it was versus powder, and when you do each. And it's a confusing world, and sometimes
Yes.
in it unexpectedly and had to research beforehand. So it can be
Yeah.
helpful.
So that's like my registered nurse spiel. I will say as a mom, I like personally, I used Bobby powdered um when my baby was 3 days old because I decided for me, I wasn't worried about the bacterial infiltration and I liked the Bobby ingredients.
Mhm.
So, but that was like the choice that I made. And then everyone kind of make their own choices. Okay, so Lindsay, you're 3 months in, about to go back to work. So going back to work obviously involves lots of feelings and logistics. So good for you facing this. If you do plan to continue to breastfeed through going back to work, it's so many feelings. Yeah, so many feelings. Um, feel them all. I felt so much anticipatory anxiety about going back to work. And then when I went back to work, I actually felt a little bit better. And then I felt guilty about that. And I was just like, Sarah, stop. What is happening? Um, so when you're going back to work, I'll just go over this quickly before I get to Stephanie's question. Um, generally, you want to try to pump 3 times while you're away from the baby if your hours are around 9 to 5, 8 to whatever it is. You don't need to line it up when the baby's eating. And you're attempting to produce the amount that your baby's getting while you're away. So if you baby gets 3 bottles of 3 to 4 ounces each, that's 12 ounces that you're trying to pump in 3 pumping sessions while you're at work. And so then you replace Monday's volume with your Monday pump, and that's what you use on Tuesday. If you have places to store the milk at work, you can put it in the fridge. I usually recommend having like a one to wash, one to use set of pump parts. And then I use the Sarah's Chill because I was doing it in the car. And that it's a thermos for breastfeeding that keeps your milk refrigerated temperature for 24 hours. So that's my kind of like very quick rundown. But Lindsay, if you have any other questions, throw them in the chat. Um, does formula make babies more gassy? Some, but really what it does is it makes them more full. So it's like if I went out and ate a burger versus going out and eating like a kale salad with a bunch of almonds and cheese on it. It's like I maybe I don't know if that's I was like, I'd probably be gassy after that. But it's basically just a more filling meal. But for some babies, cow's milk does make their gut more upset, but others it doesn't. So a lot of people use formula to encourage longer sleeping times because it keeps infants fuller longer because it takes longer to digest. Baby is 5 weeks old, breastfeeding and supplementing. I love it. Anna, you're doing great. I work night shift 12 hours. Should I pump less since it's at night? My baby only wakes up once at night. Yes, I'm lucky. I mean, everyone has their own the hurdles come for us all, just not in all angles. Um, yeah, for night shift, you are you a nurse? You likely will miss at least one unless you're able to do like the before bed feeding. Um, okay, beautiful. Uh, you might miss like that 6 or 7 p.m. if you do a 7 to 7. So you would have to pump at least around 7 to 9, and then probably again around your lunch overnight, um, which would be 2 to 3, whatever it is on your floor. So just twice for a night shift, I would guess. And then there is always a drop in breast milk supply. Not crazy, but like 3 to 4 ounces a day. It can be up to that when you return back to work, just because of the physical separation between mom and baby. It affects the hormones. So, Lindsay, you might find that you actually do need to pump 3 times while you're away when you're doing night shift, um, to keep up with the next day's bottles, but you might not. And good for you. I was a night shift nurse. I loved night shift. I didn't like the lifestyle, but I loved the shift. Um, okay, did I miss any questions in here? Uh, Hazel, I saw tired all the time. Yeah, 100%. I also thought that night shift nursing would like make it easier with the sleep deprivation of a newborn. Not for me. Didn't make it easier for me. Um, Let me link for those of you, I guess, is anyone expecting in here or is everyone feeding? Because I was going to link the latch video in case people wanted to copy it. Let me bring that up. I'll put it in the chat just in case.
Yeah, I remember watching that video when I was pregnant and preparing for everything.
It's like the best one. And now it has ads. So I'm so glad that they're getting
Oh,
paid.
really?
Every like 6 months, I would just give like a donation to them because I just use it so much. And finally they're running ads. I'm like, great. I don't know why I sent you guys the Arabic one. What? Let me find the non-Arabic one. But I love that they have that. They have it in every language.
That's awesome.
Okay, here you go. Oops. And then another thing to consider when you do increase your pumping frequency versus direct breastfeeding is that pumping is technically like not a full drain, just by nature of like the mechanics. So baby comes to breast and latches onto the areola, compresses the breast, and then pulls, which is like a deep clean versus a pump attaches to your areola and just pulls. It doesn't have that compression portion. So it's more like a Roomba where like corners are missed. And because of that, when you do increase your pumping volume, whether it's for a vacation or going back to work or what have you, I always recommend just being mindful of plugging and our guidelines on plugging. So, like milk getting trapped in your breast and then becoming tender and swollen and needing attention that could potentially advance into an infection. The guidelines on that have become just ice and Advil. And then sometimes, like Lindsay, with moms planning to return back to work, I recommend that they take sunflower lecithin and a probiotic just preventatively to keep the breast health happy, um, and to prevent plugging. So you could consider that just for prevention. And then if you get back from a shift and you're like uncomfy, ice in Advil for 24 hours. Advil as advised on the bottle, and icing as much as you can. And that is outlined. I can link that too. There's a great like Cleveland Clinic guideline on what we're doing there. Because if you ask ChatGPT that, they'll tell you to like heat up the breast and massage the crap out of it. But we've moved away from that. So I will link that. Any other questions in here?
I don't think you missed any. So if anyone has any more questions, feel free to ask them now.
Yeah, I can also go into a more extensive overview of feeding or back into hand expression. So if no one has questions, I'll just bring up my normal presentation and go over bottle feeding or pumping or which pumps I recommend. Lindsay, what pump are you planning on using? Mhm. LV Stride, great. Is that working well for you? LV Stride is like a wearable that hooks into your belt. So you wear it. It's not totally in bra, but it's pretty much in bra. And the thing with the what is someone comfortable? Yeah. So the thing about wearables is, so there's two different types of pumps. There's pumps that kind of are tabletop, and then tubes feed into what is the flanges that sit on your breasts. Um, and that is more like for the beginning for establishing a supply. And then wearables are great technology, but you run the risk of them not working as effectively for you or being uncomfortable just based on your breast shape. And so it is good to kind of, it's good that Lindsay has a few to just try, because generally the wearables are either less effective or they take longer to drain. And the tabletop pumps, like my favorite pump for establishing a supply early would be the Spectra S1. And I usually recommend establishing the supply with the Spectra S1 at first, and then moving towards a wearable as you get more established with breastfeeding. Yeah, the money I've spent on pumps is astronomical. That's fair. The
So
money
would
on,
you question on that?
yeah.
As you're more established, maybe a couple months in, would you use a wearable even at home in place of the Spectra eventually, or the big pump?
So I ended up using the Spectra throughout my like whole breastfeeding journey because the wearable never worked as effectively for me. I would use the wearable if I was like pumping and dumping at a wedding. And I
Okay.
would just like put one side of it in a clutch and go to the wedding. Um, but yes, if it's as effective for you, like I had a client that I'll never forget. She was a competitive gymnast. So she was like, I want to pump exclusively for one full year. And I was like, okay. And so the LV worked really well for her. And she was able to pump 4 times a day, 10 ounces every time. And I was like, wow, you are doing it. And it worked for her.
That's awesome.
But it doesn't for everyone.
Mhm.
But when it does, it's very convenient. And
Mhm.
so it's really about like if you're using it at home, that's probably for someone like Lindsay where it works just as well.
Mhm.
Or like a second time mom who has to run around with a toddler in addition to pumping. Um, okay, so what else from this presentation can I go over? I could go over breastfeeding positions, or I could go more into pumping and going back to work. What are other things I've met? Plug prevention we went into.
Bottle feeding, if you have anything on that,
Yeah,
positions and
yeah, let's do it. So these are generally the first two positions that you'll do in the hospital. Football is what you saw in the video that I went over earlier, and then cross cradle is laying across your body. These are the two kind of like first line that you're going to do once you deliver. These are more advanced. So for a baby who's like, 6 to 12 weeks plus, the semi upright position is the answer to the question that I often get, which is like, how am I ever going to breastfeed in public? It's generally this position. Once a baby has more head control and enjoys breastfeeding and is more efficient, which usually happens around 3 months, sometimes not. Sometimes they get really distracted around 3 months and it's a little harder. But usually, breastfeeding is more efficient. The breasts aren't full, don't feel full or empty. You're not leaking as much. Like your breasts kind of transition into autopilot at 3 months. And your baby's got a lot of control. So it's 5 minutes each side, and we're engaging in this position. Laying down and side lying is like a more evolutionarily natural way to feed a baby. And generally, babies are very calm during feeding like this. It's not, oh, it's kind of an awkward skill to master. So I usually go over it with clients in home after delivery. And you just want to make sure that you're not too tired when you're trying it, obviously. But it can be great for C-sections, where you're really just wanting to be horizontal. You always generally want to alternate where you start because babies take more from the first breast than the second. So if we always start on the same breast, we drive that breast up and we drive the second breast down. So we want to alternate where we start when we are engaging in breastfeeding. Can be good to track it because it's so hard to follow. So I recommend an app like Huckleberry. It's usually what most of my clients use. So nipple damage is one of the barriers to breastfeeding. We kind of touched on that. Hopefully, if we can nail deep latch, we can avoid nipple damage. But if we do get nipple damage, we want to treat it with what's called moist wound healing. So if you have an abrasion on your nipple, I recommend applying a significant amount of nipple cream to a clean, dry breast pad and applying that to your nipple in between feedings to keep it completely saturated in moisture, and that will lead to faster healing. And then social isolation, which I kind of touched on earlier, is just good to remember that, again, we're tribal. We're not really meant to just like be home alone with our babies. So it's good to get out, do things for yourself when you can. Um, how can my partner or support person help? So, hydration, making sure that everyone's drinking water, diapers. So, it takes about 15 minutes on each side, 30 minutes, and then 40 minutes with burping to breastfeed a baby. And then it takes about 30 minutes to then change that baby, get them dressed, and soothe them back to sleep. So, it's a pretty even split between breastfeeding parent and partner. I don't know if everyone's heard about the Harvey Karp 5S's, but this is a way to soothe a baby when they've really thrown themselves into a tizzy. You're basically just trying to recreate the intrauterine environment. So you get them swaddled up like they're in the belly, get them in a side lying position. So there's pressure on their back and their belly, sway, shush, and suck, pop a finger in their mouth, pop a passy in their mouth. It's going to be a good way to bring your baby from 60 to 0. Okay, so how do you know when to pump? It'll be different from person to person. Generally, you can avoid pumping if baby is gaining appropriately and feeding on demand. You can avoid pumping in the first 2 weeks, but you may have to start pumping if one of these things happens that delays your supply coming in and baby's not gaining appropriately. Um, But if production is sufficient and you're gaining appropriately, you can wait 2 weeks and then pump once after the first breastfeeding session of the day, and either save that or give that as a top off before bed. Because, like we said earlier, breast milk kind of runs right through them. So, some babies in the evening, when your breast milk supply is lowest, need a little more milk in order to sleep longer stretches. And you can kind of push against that evolution by giving an extra bottle. So, whenever you're about to pour from pump to bottle, you want to wash your hands whenever you're dealing with breast milk. Breast milk is good for 4 hours at room temperature, 4 days in the fridge, and 6 months in the freezer. Label your containers with the date and use your oldest milk first when thawing. So, this is kind of going again, emphasizing my plug prevention discussion. When you do have an area of the breast that's full and tender, almost like a deep cystic zit, you want to heal that nipple tissue with moist wound healing and apply ice and Advil to the apply ice to the area and take Advil for 24 hours to hopefully avoid an infection. Another thing that's really helpful, I don't know if anyone's done like a gua sha of their face, where you're basically just trying to drain lymph fluid out to your lymph system. You can do that with your fingers against your breast as well, from the nipple out towards your armpit in order to drain fluid if you do feel inflamed.
Quick question. Lindsay asked, I don't know if you saw it. She said, do you have to freeze breast milk right away, or can it be in the fridge for 2 days and then frozen?
So, such a good question. Everyone has what's called lipase in their milk. It's an enzyme that breaks down fat. When you freeze breast milk, the lipase kicks into hyperdrive and can make thawed breast milk from the freezer taste soapy, metallic, even vomity. It's safe. It just kind of tastes gross, or just different, because freshly pumped breast milk just kind of tastes like sugar water. You are less likely to have a high lipase thawed milk the faster you freeze it from fresh. But that being said, I never paid attention to when I froze mine, and I just started to introduce my lipase thawed milk to my baby early and often. And she got used to the two different flavors and just took it. So it does not matter. It's totally safe to freeze when it's on the fourth day in the fridge. It's just more likely that when thawed, it will have that kind of like soapy, metallic, lipasey taste when thawed, and less likely if you freeze it straight from pumping. Does that answer the question? I can't see the chat while I'm sharing screen, but I'm almost through with these slides.
She said yes, thank you.
Okay, great. Generally, I would say, like, I love that Babylist sends out that kind of like bottle sampler, but I usually just say pick one. And if any part of your goal is to breastfeed, like I remember someone mentioned their combination feeding, you just want to make the bottle like the breast and the breast like the bottle. So the breast is flows in phases. As baby comes to breast, they just get kind of drops. And then as they continue to suckle, they'll get like a big letdown of milk, which is a spray. And then they'll have to wait for the next spray. So they have to kind of stay patient. And like I said earlier with the latch, they have to open wide. So we want the bottle to be slow and wide. So if any part of your goal is to breastfeed, we want that bottle to be slow and wide. I would just pick one and order a few. The bottle introduction will just kind of vary based on your baby's journey. If they've got, jaundice or blood sugar issues or weight gain issues, they need a bottle. So a lot of these breastfeeding classes tell you to avoid it in order to preserve the breastfeeding relationship, but sometimes it's out of your control. So we just kind of roll with the cards we're dealt. So pick one slow flow bottle. I really like the Larkin pumping bra just to make pumping hands-free. A wrapper infant carrier just to make your life more mobile. A good swaddle blanket with Velcro or a zipper, something that's really going to contain them. Outfits that zip are just easy for overnight. And then I do really like this Harmony hand pump which oftentimes is you're sent home from the hospital with it. But it's a great, great tool. You can do this. Freeze breast milk right away or can it be in the fridge for 2 days? Okay, great. Any other questions about that stuff?
That was super helpful, I'll just say. And I didn't know about the taste and freezing it sooner than later. So that was great.
Oh, I'm so glad. Yeah. All this stuff is like, we're just
There's
discovering
so
new stuff
much
every
to
day.
learn.
My baby is taking it fine and now all of a sudden hates it. Yeah. So make sure it's bottle refusal is real. The reality is like if they're really hungry, they're gonna take it. And by 3 months, um, you have like five, your baby's sleeping long stretches at night, and so they can go that long without eating. So, heaven forbid if you have to be away from the baby and they're not taking the bottle, um, they'll eat eventually, but warming it as much as possible, like warm, not room temp, like you feel the warmth. Obviously, don't burn the baby, but it has to be warm. And then by 3 months, they just want to move. So trying to give the bottle while moving in a rocking chair, in a bouncy seat, whatever will help. And then just giving more bottles. So the more frequently you give them and consistently, the better they'll get at the skill. It could be the lipase thing. If that is the case, I would start to cut thawed milk with fresh milk and warm it up a ton just to kind of orient them with that taste because they will adapt to it. But movement, warmth, and consistency are like the big three things to improve bottle refusal. Babies kind of go in and out of like breast refusal, bottle refusal. They'll like bop back and forth. So whatever they're refusing, you just want to introduce more. And know that by the time they're 3 months old, they can afford to go a little longer between feeds and you're fine. But I do bottle refusal consults all the time because it's so stressful. Um, the other thing about a bottle is sometimes as they get bigger, they start to get frustrated with the flow. So if you're still using a slow flow, like from the beginning of your breastfeeding journey, you may consider going to faster. Because as you continue to breastfeed, your breasts become more efficient and they flow a little faster. And so they're used to that flow. And when they come to a slow flow bottle, they're frustrated. And then I don't subscribe to the idea that like mom can't give a bottle. I know you'll find that on the internet. I don't think that's real. So I think anyone can give a bottle. Some people say like mom shouldn't give a bottle because then they're just going to want to breastfeed. Um, I don't think babies are really like understanding things on that high a level at that early of an age. So I would say anyone can give it. No limit. But it's got to be really warm because your breast milk is really warm. I mean, your core body temperature is 98 degrees. So it's pretty warm. Um, what else about infant feeding? I actually recommend that everyone be on a probiotic that has L-fermentum and L-reuteri on it if you plan to breastfeed at all. The research on that is like pretty good that it increases that those two strains of probiotic are really good for breast health and were absent in women who are prone to mastitis. So I'll put that in the chat as well. L-fermentum and L-reuteri. So a brand that has both of those in it is the Garden of Life Women's.
Do you know if any like general postnatal vitamins would include that, or do you have to get a separate
You have to get a
probiotic?
separate probiotic. Yeah, no, they don't. Um, the postnatals, I think, just have like an acidophilus strain, which is the same strain you're going to get in yogurt, which is like so great for acidophilus is great for vaginal health. That's going to be good for like if you're taking a antibiotic and you're at risk for developing a yeast infection. the yogurt is going to be your way to go, acidophilus. But these two are good for breast health because there is a known pathway between the gut and the breast of probiotics specifically. Um, Another like just kind of myth busting stuff is cruciferous vegetables or gas producing foods won't necessarily increase gas in your baby if you're breastfeeding. The gas production part of fibrous material is the fiber itself, because you put fiber in your gut and then your gut microbiome starts to eat it. And when your gut microbiome, all that gut bacteria eats fiber, it produces lots of gas. But that fibrous material is actually not translating to your breast milk and then giving your baby more fiber that is gas producing necessarily. So I don't usually recommend avoiding any foods while breastfeeding unless you notice a strong association. Like I trust moms. If a mom says to me, every time I eat garlic, my baby's fussy, I'm like, okay, let's not eat garlic. If you notice a pattern, avoid it. But in the absence of any baby symptoms, I don't have moms limit diet at all.
What about with dairy? I feel like I see that one a lot. People cutting that out.
Again, only if baby has symptoms. So yeah, the first thing we look into with a baby with colic,
Mm.
unexplained crying due to gut discomfort, the first thing we talk about is cutting dairy. Because statistically, the most likely cause of that discomfort, if it is going to be anything in mom's diet, is going to be cow dairy. Because of kind of what I talked about earlier, where the proportion of the two proteins in cow dairy is different and is harder to digest for infants. So it's not necessarily like an allergy, it's more of an infant intolerance. But I don't recommend cutting it in babies who don't have any symptoms. Like if you're thinking like, well, if it's a risk, like why not cut it? And the reason why I would not do that is if we do cut it from a newborn's diet and they have no exposure to dairy until they get solids, then they actually are more likely to develop an allergy. So in a baby that has no reaction to it, churn it into them in like tiny micro doses through your breast milk because that's going to give them this tolerance for it that then when they get like a bowl of yogurt at 6 months, they'll be good to go. The other thing to keep in mind with newborns, new newborns, is we want dye-free soaps that we're washing their dishes with, dye-free Tylenol if you're giving it or if you need to. Um, Scentless soaps as well, just to reduce skin irritation or hormone interruption. Um, I am very pro pacifier. Depends on who you ask. I love passies. I think that their benefits far outweigh their risks. Babies love to suck. It increases gut peristalsis, so it gets their gut moving. It calms them down. It starts their digestion. They love to suck. So I don't know. I think that the threat to the breastfeeding relationship is much lower than the benefit to your sanity. So I'm very pro pacifier. But again, choose your choice. I support whatever anyone chooses. I'm
I have
trying
a
to think of,
pinky loving baby. And now my challenge is going to be how we take it away from her.
well, I have a 2.5-year-old and she still gets it at night. And
Okay.
our pediatric dentist was like, yeah, technically we'll cut it by 3, but my
Okay.
kids all had it until they were 4. And I was like, wow.
Stop. Okay, that could be
So
some reassurance.
yeah, you just again, you just choose your choice.
Yeah.
Like it's been such a big part of my daughter's sleep. And most of the time it's not even in her mouth. It's
Mhm.
rubbing, she likes to rub them against her eyebrows.
That's funny.
And I'm like, you know what? We're all sleeping and her teeth are fine. So yeah, it's totally up to you. But I hear the opposite that like, oh, I tried to cut it at 18 months and it was hell and I hated it. And if I could go back, I never would have introduced it. So everyone kind of has
Yeah.
their own choices, their own baby, all that jazz.
Do you
So
have any tips for getting babies to take it? Because I know some people struggle with that. They want the baby to take a pacifier and they won't take it.
The only thing I'll say about pacifiers is those like soothy, rounded pacifiers that are given when you deliver are built to pop out of the baby's mouth. So they use them, and then when they don't need them, they pop out. You do want a rounded tip. You don't want a slanted tip just for orthodontic development. Um, I will say I think the Tommy Tippy pacifiers are the best for staying in the baby's mouth and also being a good shape for palate development.
Good to know.
So my only tip about that would be look into Tommy Tippy, I guess. But yeah, some babies just don't really have the organization to take a passing until they're bigger.
Mhm.
Much like some babies are born and they're just like totally disorganized at breast because I
Mhm.
don't know, they're stunned or they just don't quite have the skill yet or need a little bit of time. Um, but yeah.
So,
Um, you can drink coffee while you're breastfeeding. If you're safe to drive, you're safe to breastfeed when it comes to alcohol. Anything else that anyone has?
I think these were all amazing tips and knowledge to have in a
Oh,
very digestible way. So I think sometimes it's just a lot of information about breastfeeding and it can get overwhelming.
yeah, I'll also put here, and this chat will disappear when we log off. So if anyone is liking any of these links, I would just, oh, you're welcome, Lindsay. I would just save them. KellyMom.com is an evidence-based aggregate of information on newborn care and feeding. I reference their catalog a lot. It looks a little janky, kind of like Wikipedia, but it's all evidence-based. So I go there for most of my information. If you're not on a page with a reference section, just remember that like this is someone's opinion. Like when I said I love pacifiers, that's my opinion based on kind of what the research I've done. But it doesn't necessarily mean that the only answer is to use a pacifier. So yeah, just make sure that you are going to kind of evidence-based things and knowing that your journey will be totally different from someone else's, and that doesn't make it right or wrong or worse or better than anything else. So Kelly Mom is a great resource to have.
That's great. Well, thank you so much,
Of
Sarah.
course, of course. Thank you for having me.
Thank you. And thanks everyone for joining. I hope you learned as much as I did. Um,
And yeah, talk to you all soon.
sounds great. Thank you.
You're welcome.